plenty of bright sky, the best of the sunshine to central Britain, down to the southwest and across Ireland. And here the
soundtrack to Lancashire sunshine, 97.4 Rock FM.
Going twins Hassan and Hussein Ben Haffa, who were successfully separated back in April.
Yo-Yo Ma, in case you're thinking Yo-Yo Ma, John Cooper.
Let's roll. Thank you so much. Mark Armand is here with us now. LL Cool J is with us. It's Terry Venables.
There you go, Mum. Are you okay? Oh. What's the matter? Something wrong with your hand?
Yeah.
What's the matter?
Jean has had a TIA, or a mini stroke as we call it. She had some drooping of her face on the right side, weakness in her arm, and also some speech difficulties. It is important that Jean seeks help urgently. Fortunately, her daughter was there and has rung 999, and Jean was taken into the emergency department straight away. The main goal following a TIA is reducing the risk of stroke. People with a suspected TIA should be thoroughly assessed for subsequent strokes, and this can be done by a validated tool like the ABCD2. The ABCD2 tool consists of 5 elements like the age of the patient, the blood pressure at the time of the event, the clinical features that they presented with, and the duration of the symptom while it lasted. Along with these 4, if the patient is diabetic, that increases the risk of a TIA or a stroke. This tool allows us to identify the patient who are at risk of having a subsequent stroke. By the time Jean got into the emergency department, she was feeling much better and her symptoms had completely resolved. The doctors did their initial assessment, did a blood test, her vital signs, and an ECG, which is a reading of her heart, and they concluded that she was well enough to be discharged. She was also started on a prescription of aspirin, which was to be taken daily. She was then booked into the emergency TIA clinic, where a stroke consultant would see her within the next 24 hours.
Hello.
Hello.
Jean Marsden.
It is, yes.
Okay, and date of birth the 14th of June 1943.
Yes.
My name is Dr. Ponika. I'm the consultant physician here in the TIA clinic. And are your daughter?
Yeah, I'm Sophie.
Hi. Okay. A TIA, or transient ischemic attack, is also called a mini stroke in simple English. It is exactly like a stroke, except that the effects do not last long at all. The effects generally last a few minutes to less than an hour, and according to a traditional definition, should last no longer than 24 hours. So the main thing with the TIA is it is a stroke that goes away very quickly and does not leave any disabilities behind. The conditions or risk factors that predispose to a TIA or a stroke are common, and these include high blood pressure, diabetes, advancing age, heart conditions such as an irregular rhythm of the heart, which gets more common as we age, and that is called atrial fibrillation, other conditions of the heart such as a heart attack in the past or angina, obesity or being overweight, physical inactivity, and also conditions such as a high level of cholesterol, or sometimes a narrowing in the artery in the neck that can throw a clot to the brain. Younger people, especially those people who are age 55 years or younger, can have all the risk factors that we have discussed now, but in addition they could also be suffering from other conditions such as an abnormal connection between the right side of the heart and the left side. They could be suffering from clotting abnormalities, or conditions that we call autoimmune conditions, or they could also be taking recreational drugs such as cocaine. The concern that we have with TIAs is that these in some patients can lead to strokes. The risk of a stroke is highest in the first 48 hours, and we have a particular scoring system that we currently use to stratify patients into high risk or low risk. And this scoring system uses the patient's age, blood pressure, what symptoms they had, such as have they had weakness down one side or speech disturbance, and what is the duration of the symptoms, and lastly if they have diabetes. If they score highly on this particular scoring system, then the risk of a stroke in the first 3 months can be as much as 1 in 5. We always get blood tests in the clinic, such as a blood glucose or cholesterol levels, if these have not already been done by the GP or the A&E department. We take an ECG on the same day in the clinic, and we try and arrange a carotid ultrasound scan, which is a scan of the neck vessels, to see if there is a narrowing that may have been the cause of the TIA or the stroke, and this is arranged on the same day.
Hello, I'm Stephen D'Souza and I'm one of the vascular radiologists. I've been asked to do an ultrasound scan of the arteries in your neck to see if there's any significant narrowing which may have resulted in the symptoms that you've experienced. As a result of this investigation, we may go on to perform other investigations, including CT or even angiography. Great, that's finished. Okay, what we'll do is I'll just get you some paper towel just to wipe that jelly off your neck. You can also use the gown to wipe any excess jelly off.
Right.
I've not been able to find any abnormality on this scan, but we'll get you back up to the clinic to discuss with Dr. Punica or Dr. Emsley what's going on.
A proportion of patients will require further scanning, such as an MRI scan of the brain.
This lady behind is having an MRI scan of the brain, which approximately takes around 20 minutes. The patient is positioned within the bore of the magnet, which is open at the other end. The scans are quite loud. For that reason, the patient will have a pair of headphones to firstly protect hearing, but also so that we can talk to the patient throughout the scan to ensure that the patient is happy in there. The patient will need to remain still for the entirety of the examination, and the radiographer will observe the patient all the way through. The patient will have a call button in their hand. If they're not happy at any time of the procedure, they can press that and the radiographer will enter the room and bring the patient out from the scanner.
Or sometimes if other conditions other than a TIA are considered, they might need a CT scan of the brain. An echocardiogram of the heart, which is a scan of the heart, is required especially in younger people, and again people under the age of 55 may require further blood tests. The treatment in a patient who has had a TIA is primarily directed towards the prevention of a stroke. And this treatment includes aspirin given immediately or as soon as possible once a diagnosis is confirmed, and then followed by a medication called dipyridamole retard, which is a capsule given twice a day, which tends to cause headaches in a proportion of patients, but these headaches tend to go away within a few days. We also give statins, which are cholesterol lowering medications, and we give blood pressure lowering medications in a significant proportion of the patients. There are some patients who have a condition called atrial fibrillation, which is an irregular rhythm of the heart, and these patients benefit from warfarin therapy unless if they have a reason not to have warfarin. It is absolutely important for you to stop smoking if at all you're a smoker, and for you to cut down your alcohol intake if you drink excessively. These are very important as smoking and alcohol excess are risk factors not only for TIs and strokes but also for heart attacks. And as far as diet is concerned, I would like you to eat healthily and have a good proportion of your diet to have fruit and vegetables, fish and poultry in it. It is important that you do not cut out all fat and oil from your diet, as your cholesterol lowering medication would lower your cholesterol significantly. You will need to take regular exercise, at least 3 times a week, and it is important for you to lose weight if you are overweight. It's important for you to reduce the size of your waist, as the waist size has been found to be more important than your overall weight in the risk for stroke. There is a driving ban for 4 weeks starting from the date that you had your TIA, and it is important for you to stop driving all vehicles, but you do not need to inform the DVLA. Once you finish these 4 weeks, you can start driving again. Okay, so the plan is for you to take the 3 extra medications that I've prescribed from today, and then I will see you in the clinic again about 6 weeks' time. Okay. All the best.
Thank you.
Our patient has not had any further TIAs or a stroke. They were discharged back to the care of their GP on medications. It is important that you are able to recognize the symptoms of a TIA or stroke. We have a test called the FAST test, which is a simple way of doing this. FAST. F stands for facial weakness. Ask the patient to smile and look for weakness down one side. A stands for arm weakness. Ask the patient to lift both of their arms up and look for weakness or an inability to lift one of the arms up. S stands for speech, and look for difficulty or an inability to get words or sentences out, or if the patient is slurring their words. T stands for time, as this is an emergency and you will need to call 999 and get the patient straight to the emergency department via an ambulance.